So what happens if someone undergoes a facelift and wakes up with facial weakness? Well, there are really 5 main causes of facial weakness after a facelift. The first thing is that the local anesthetic that we instill during surgery can be a little bit persistent. So the key to waiting that out is just that the facial paralysis should resolve within 4 to 6 hours or by the next day. The next thing that can happen, the next most common thing, is that some facial nerve branches can be stretched during the dissection. This can result in isolated zonal facial weakness in one part of the face or another for a few days to weeks. That is also self-limited and ordinarily gets better on its own. The third thing that can happen is that some of the facial muscles themselves can get irritated or stunned if directly exposed during the facial dissection. So sometimes we expose the muscle responsible for smiling or lower lip movement when we are working in that area, and that can result in, again, a transient weakness that can last days to weeks. The next thing that can cause facial weakness after a facelift is actually suture strangulation. So we use some sutures to pull up the tautic structures in the face, and once in a while, one of those sutures can catch or strangle a facial nerve branch. In that situation, we are unlikely to see totally appropriate recovery unless we recognize it and remove the suture. If we do recognize it and remove the suture, essentially normal recovery is the norm. And the final and most dreaded complication involving facial weakness after a facelift is when somebody wakes up with isolated or complete facial paralysis and it doesn't get better after several weeks. Usually that can be attributable to inadvertent dividing of some of the branches of the facial nerve or even a very main branch of the facial nerve. Now, in those situations, if we explore and repair and sew that nerve together, we're really likely to get good recovery. But if we wait too long, expecting that perhaps there'll be spontaneous recovery, that's when we can get into a problem with inadequate recovery.